And I will say it's kind of a common story for a lot of us in healthcare. I mean, I'm guilty of it too. Mine was a little bit earlier in my career than yours, but when my kids got to be teenagers or young teenagers, I'm like, you know, I want to be able to be healthy with my kids. I want to be able to ride bikes with them. I want to be able to,
Yeah.
play baseball with them instead of just, sitting on the couch and being tired all the time. And really, when you look at, you and I were chatting before the podcast, when you look at, go to a typical hospital and go into the lunchroom at lunch and just look at the healthcare workers and how unhealthy most of them are. Shift work, not sleeping and, then not eating well and eating at poor times and not eating good food. And, the health of, we're supposed to keep patients healthy, yet most of us aren't healthy. So that's when I had an aha moment. And I'm so glad I did. And I'm glad you did, because you're right. We have skills and people need us. And,
Yeah.
and we need to, we can educate them to be healthy themselves. And I think we have to start with ourselves. We have to be good examples. And most healthcare professionals are not.
Right. Well, I think that's really a big problem, is that we're not taught self-care in medical school. And as a matter of fact, in residency, we're taught, to put ourselves last. And this expectation that doctors, especially of all healthcare, will donate their time, are expected to work without compensation. Throughout the whole pandemic, doctors were expected to work more without more compensation, but no other member of the healthcare team was expected to work multiple extra shifts without compensation. And that is, I think, the biggest issue, is that we spend the most time learning how to do our craft, and then we take the most responsibility, and then we have the most liability, because nurse practitioners and PAs are hard to sue, and doctors are easier to sue. So it's a real conundrum, I think, in the medical field, and I think it's done on purpose. I think we're taught certain things. We're taught how to manage disease, not to prevent disease.